Hi, I'm Rebecca Rose, and I am the founder and chief scientist of InClover. I'm going to talk today about healthy joints. And part of what qualifies me to talk about that is that I have been working on research on healthy joints for animals for about the past 20 years. And before that, I was working on research that related to this in the human side of things. So I'm very excited to share some of the things that we've learned and to give you some tips about when to start with joint health care and how you would know that. So for now, let's get started talking about joint health care. So we have, at InClover Research, we have done some really interesting science that we'll go over. And that interesting science told us that all animals could benefit from healthy joints and joint care. We know that about 1 in 4 dogs and cats are going to suffer if we don't get started early with joint care. So we're going to talk about when we would start and how you would know. So we'll go to the next slide. There we go. So as I mentioned, I am a biochemist, chief scientist of InClover. And one of the things that we have done at InClover, which is a little unusual, is that we gathered people who had tried everything with their dogs and cats and could not get their joints and their mobility back to where they used to be when they would take walks, jump up on counters, and jump in the bed with them. We took them in a university clinical study. So these are just normal people and their pets. And they came in and they participated in our study. And in that study, what we learned is that we can not only help these animals go back to doing the fun things that they do, but we will also be able to show you how we can get ahead of joint problems so that we can have them living longer, healthier, happier lives. So the next slide. Okay. So this is a picture of our line of complete clinically tested joint supplements for both dogs and cats. One of the nice things is that we're able to help animals that maybe it's not so easy to give them medicine. And we were able to, in our clinical study, look also at what's the easiest way to give a supplement every day. Because with joint supplementation, you do need to give this every day. So what we've done is we've said, okay, let's do this in a powder form. If you want to sprinkle it over your food, you can. Let's do it in a crunchy tablet form. That's like a hard biscuit. And let's do it in a soft chew form. So the most popular forms are the soft chew form and the powder form that works for pretty much every animal. Also, the animals that can take this are all life stages of dogs and cats. So in our clinical work, we were looking at animals from 6 months old to 19 years old. And what we've learned is that not only are joint problems uncomfortable, but we've seen a huge, tremendous growth in joint discomfort and joint disease over the last 5 years. So a couple reasons for that, one good, one bad. So the good reason is that our animals are living so much longer than they used to. So that's fantastic. And as I mentioned in our clinical study, we had animals up to 19 years old. So as they're living longer, they're starting to develop more signs of joint issues. The second thing, not quite as ideal, is that more of our animals are overweight. So one of the things that you can do in addition to supplementation is that you can make sure that your dog or cat is at an ideal weight. Because connecting can be given at all life stages, we do recommend that you start as when they're a puppy or a kitten. And this may seem counterintuitive, so bear with on this. So when an animal is young, a puppy or a kitten, then they will start to develop that joint capsule. So all the joints in the body, whether it's in the back or the big joints in the hips, in the legs, or smaller joints, elbows, knees, they'll start to develop those, and it will form a cushion that's bathed to make it move and make it move smoothly. In order to get a better foundation, you'll want to start with joint supplementation early. That will allow the joint to form a good foundation as they're growing very quickly. And you know, if you've had a puppy or a kitten that's fast growth, you feed them a lot, it's hard for their body to keep up making those joint building blocks. So supplementation is key. All life stages, but start when they're a puppy or a kitten. It's important that you look at joint supplementation for a complete option. So a complete option would be something that's safe and effective for all types of joint disorder. It's not just adding one ingredient and impacting maybe a very, very specific joint problem. This would be something that is complete. It's something that adds all three of the joint building blocks. So on the label, look for the 3 joint building blocks. Look for glucosamine, look for chondroitin, and look for hyaluronic acid. And then look for a way that those can be delivered, because what happens with joint issues is that that area around the joint will get inflamed, and it'll make it difficult for the supplement to be delivered and to be delivered quickly. So we're going to talk a little bit about what's happening within your pet's body so that you understand a little bit more of the good stuff that you're doing when you're offering supplementation for their joint. So this picture on the screen is a normal, healthy, happy joint. And what you see is that there's synovial fluid, and that's like a thick, viscous liquid that's bathing that joint space. And in between the bones is healthy cartilage. And the cartilage is what is allowing for a smooth movement. So that's what we want to get back to, and that's what we see in a normal, healthy joint. Now, what is it that makes up, just going a little bit deeper, peeling back one more layer and looking at what's in a normal healthy joint? And you can see that that cartilage is made up of glucosamine and chondroitin. So you would want to, when you supplement, make sure that you're adding glucosamine and chondroitin back into the cartilage. So in a normal situation, they're taking the good nutrients from the food and they're pulling out the components that make up glucosamine and chondroitin. With supplementation, we're not replacing that at all. We're not stopping the body from doing that. What we're doing is providing the body with just a little bit of help. And so that's why it's good for all life stages. What the glucosamine is doing is protecting that layer in between the 2 bones of the joint. And the chondroitin sulfate is producing elasticity, while the hyaluronic acid is what is the primary ingredient in synovial fluid. So that's what's washing the joint. So if you think about each of those and how they're working in a little bit more depth, the glucosamine is like a pillow. So what we're doing is putting some more stuffing in that pillow and making it just a little more comfortable around that where the joints meet. And with our product, what we do is use a very, very pure glucosamine source so that you know that what your pet is getting is the best, purest glucosamine, and that's going to allow that cushion in the joint. And then once you've built up that cushion, what you need to think about is how to make that joint move and have more elasticity. And that's what the chondroitin sulfate does, is it gives the joint easier movement. So if you've ever noticed your dog or cat sort of having difficulty getting up or lying down, and they're just not as fluid in their movement as they used to be, that's an indication that they need more chondroitin in their diet. And then the last joint building block is the hyaluronic acid. Hyaluronic acid is what's naturally found in between that joint capsule. It's found in synovial fluid, And it is like the WD-40 for the joint. It keeps it lubricated, it keeps it comfortable and moving smoothly. When you're reading your ingredient decks, look for this. It's often the one ingredient that's missing from joint supplementation, and it's very important because we want to make sure that we're supplementing with all three of the joint building blocks so that that joint can move and can move smoothly and is really comfortable. One of the things that we're known for at InClover is our thoughtful formulation. So I formulate all of our products. We have about 40 supplements that we offer. And the Connectin was the first supplement that I had developed. So as I was looking at how to bring together all of the ingredients, one of the details that I looked at was, how do we make sure that the most pure and bioactive ingredients are going into all of our products? With the glucosamine, we use a pharmaceutical grade, but also in a supplement, you have to have a carrier on the glucosamine. So sometimes a very large carrier is used. So if you can just picture, I'll use the analogy of this orange that you see on the screen. When you go to the grocery store and you buy an orange, you don't know if it has the fruit in it, which would be like the active, what you want, or if it's a really thick peel. When we developed Connectin and picked the glucosamine, we looked at it from that level of detail where we said, we're going to pick a carrier, which is like the orange peel that will deliver the glucosamine safely into the body. But we want it to be really, really thin. We don't want to have a lot of peel and very little of the medicine that we're looking for. We want it to just have the what's called the hydrochloride, the HCl carrier. And that allows us to get more glucosamine into your pet's body. And everything from picking the right glucosamine to understanding where all of our ingredients come from and having visited the farms where we get our ingredients, all of those things make me feel more comfortable. And as somebody who gives joint supplements, our Connectin to all of my animals, and I also take it myself every day, it's important to me that we know that it has the best ingredients and the highest purity. So let's go into just a tiny bit of the science so that you can understand what the results will be because of the science. So something that's unusual about Connectin is that when I developed Connectin, I felt we had a really solid product. However, I did not know of any way to tell how well it was going to work except to bring together these animals and the humans that love them who had tried everything else and could not get their pet to go on long walks, to jump up in the car anymore, to do all the things that they wanted them to do. They joined our clinical study. We did 3 clinical studies, actually, one in New York, one in Colorado, and one in New Zealand. And we gave them either Connectin or we gave them a placebo. So none of the scientists, the veterinarians that did the study, knew which they were getting. And what we found was that with the animals that got Connectin, they saw increased mobility, ability to bear weight, and less discomfort on average in 15 days. So pretty amazing. So think about what your animal is experiencing or what you don't want to make sure that you can prevent, and think about how fast you can see results. Now, why is it so fast? Well, because it is complete, it has all 3 of the joint building blocks. It also has a natural and patented delivery system so that all of those joint building blocks get into the affected site and they get in really quickly. And that's important because if your animal is showing discomfort, you don't want to wait to see results. You want to see it fast. So we went through months and months and months of clinical work to come up with the best formulation that will work with the most animals and that will work most quickly. So we tested it so you don't have to test it on your pet. You know that when you start, that in on average of 15 days, you're going to see great results. as we were doing our studies, we thought we would probably see good results. We were optimistic about that. But the one thing we didn't realize was how fast we would see results. If you can think about, in a normal situation, when you start on joint medication, usually you'll want to think about waiting about 6 weeks before you'll see results. With Connectin, we saw statistically significant results in 15 days, so about 2 weeks. And why is that? Well, it's because of our herbal delivery system that it acts so quickly. So there are a few things that are happening when your animal is experiencing joint discomfort. One of the things that's happening is that the animal is not able to get the joint building blocks to the affected site because they have inflammation, they have poor circulation. There are a lot of things going on behind the scenes that we don't even realize. Because there are no nerve endings at the joint, they don't often experience pain until it's already been destroyed. That area between the two joints, the bone, the cartilage is already destroyed. So we don't want to wait that long. What we want to do is make sure we're delivering the supplements to them. We're doing it quickly and effectively. So the Connectin's patented herbal delivery system will do 3 things. It will address the inflammation, it will increase the circulation around the joint, and it will also stop those damaging free radicals from causing more breakdown in the joint. So it will stop and slow that process. And all 3 of those things are really important because we want to make sure that our animals have the best chance of seeing good results as quickly as possible. We just don't want to wait. And the other thing that we found in our clinical study is that we had done full x-rays to make sure that there was arthritis or hip dysplasia, or with small dogs, it's patella luxating patella, that's the kneecap that floats around. We wanted to make sure that we could identify that it was a problem of joint disorder. Once we did that, we started them on the Connectin or on the placebo. When we unblinded it, we found that the animals that were on the test, the Connectin, that they had not only shown measurable improvement in the joint that had the arthritis or hip dysplasia, but also in the joint beside it. So what that tells you is that even though modern science can't measure what's happening, the animal was feeling the effects of arthritis or hip dysplasia starting in that joint beside the one that had arthritis or hip dysplasia. And you can relate to that if you have ever had a sore muscle and then the other side of your body gets sore. So they start to overcompensate and move to the other side of the body. With Connectin, what we found was that not only does it help with the joint that is currently showing arthritis or dysplasia, but it also helps to prevent the other joints from having problems. So that, I think, is probably the coolest thing about the clinical studies that we found. And the 3 different formats of the product for both dogs and cats, Connectin is available in a powdered form. We also have the crunchy tablet, and we have the soft chew as well. We have different sizes and formats. So we have a small size that you can start just to do a test on it. And it's set up so that it will last 2 weeks, even on a large dog, and that will give you enough time to see results. And I think that's really important, that we see results and that we see results quickly. So let's talk a little bit about how you might know that your animals are showing problems. So one of the things that we know is that with many large breeds, the larger joints, the hips and the the shoulders, that's where they're going to show the problems. And it's pretty common. And so, like for me, for example, I have two dogs. One is a 25-pound shepherd, looks just like a German shepherd, except he's small. And the other one is a 60-pound golden retriever collie mix. And so for both of them, they are prone to having joint problems. Two different areas though. So my larger dog prone to having more of the hip problems, difficulty moving around. The smaller breeds though, very, very common for them to have problems with their knees. So as they're jumping down off of higher surfaces, that's when you're going to start to see them hit the ground and have those knee issues. Giant breeds really need to get them started on it early. And of course, with active breeds, you want to make sure that you are putting that preventive layer in. If you have an older or an animal that might be a little bit overweight, that would be a good indication that you want to get started on joint health sooner rather than later. And if you find yourself in the Pet Food Express stores and you're looking for a Chuck-It or a Frisbee or something to hike with your pet, think about also adding a supplement in with that, because you want to have that daily supplementation. Something that I find is that because I'm feeding Connectin every day with my animals, with my dogs and my cats, I find that they're getting all of that extra anti-inflammatories, the things to increase their circulation, their antioxidants. So in addition to the joint building blocks, they're getting a lot of other healthy, good ingredients. And some of the things I mentioned that we have now, our animals getting are getting heavier. We're seeing that more than we ever have before. Once you start on Connectin, they will be able to be more active. So it's not, I want to wait until I can get the weight off, but giving them all of those good nutrients plus the joint building blocks is going to help them be more comfortable, so they'll move more. So I'll give you a little example of that with a cat that we had fostered at the InClover office. So Chloe came to us at 17 pounds. Her ideal weight was, they estimated, 9 pounds. So she had been in a home situation that wasn't a very healthy one for her. She had been left alone, free feeding, and hadn't gotten any exercise. So when she came to us, she had already been at the shelter for more than 60 days. And that creates some issues with a cat that they wanted her in a foster situation immediately. So we brought her into the InClover office, and we put her on a better food. We started her on Connectin supplementation. And what I would do is I would take her food and I would put it around the office. I would take her supplement and I would put it around the office so that she would have to find and chase, in some cases, to get her daily nutrients. Once she started to have more comfortable joints, she started moving around more, and we were able to expand that game. And I'll let you in on a secret that we don't publicize, but since you joined us on a Sunday, I will tell you that what I used for Chloe was our Connectin Soft Chew, which is for dogs, formulated in a size for dogs, is exactly the same ingredients as in the Connectin that is for cats. The cat product is in a powder. So with Chloe, I wanted her to be more active. So what I did is, the ideal amount for a cat is 1/4 of the soft chews that are Connectin soft chews. So I just broke it into fourths, and then I would just throw it down the hallway to her. And she would, at first slowly waddle, and then she got better and better at moving until we were able to, over time, it took a while, but we were able to take her weight from 17 pounds to 12 pounds. When she would hit 12 pounds, we posted a picture of Chloe, and she was snuggling with my golden retriever mix. And we posted that on the shelter site, and she went to the best possible home she could have gotten to, and they were able to take her weight down, continue her on Connectin so that she stayed healthy, and she was able to live a more normal, active lifestyle, which I think is all everyone wants, is to make sure that they are healthy and active. So just to go through then a few of the key points, Connectin is complete. It has all of the joint building blocks, and then it also has the herbs that will deliver those joint building blocks and give your pet more of the daily nutrients that they need. It also will work in 15 days. And so that is a much easier way to get supplementation started than to wait that 6 to 8 weeks that you would normally expect. It works on all joint problems, so it is set up for success. Not only is complete, but it's thoughtfully formulated to work on all joint issues. All of our products are made in the United States. We proudly have earned the right to display the National Animal Supplement Council quality seal, which is the benchmark of quality for supplementation. Connectin is 100% guaranteed, and we also are a green company. So we are the top impact award winner for supplements from the Pet Supplement Coalition. And so we're really proud of all the work that we've been doing with sustainability as well. And we have a lot of really good feedback from folks, but I would love to take some time today to go through and answer any questions that you may have about supplementation, specifically for joint supplement, or if there are broader questions. As I mentioned, as a biochemist and a product developer, we have about 40 supplements, and all of them are safe to give together. And so in talking about how you might start that, I'm happy to answer any questions. But it looks like we do have a lot of questions. So I'm going to go ahead and get started. And please feel free to submit questions, and we'll get through as many of these as we can. So one question that I have is, can I give my dog or cat Connectin if they're already on Rimadyl or carprofen? So those are what's called NSAIDs, so anti-inflammatory drugs. Rimadyl is a very common one. Carprofen is a little more recent. So if you take your animal to your veterinarian, they will often prescribe one of these nonsteroidal anti-inflammatories. And so, yes, the answer is yes. It is very safe to give Connectin while you're giving the nonsteroidal anti-inflammatory. Oftentimes, vets will start on both the nonsteroidal anti-inflammatory and Connectin. The NSAID is a really powerful anti-inflammatory, so right away it'll block those inflammatory receptors. So it will tell your animal that, wow, I don't have pain anymore. I'm not sure exactly what happened. What the Connectin does is it will provide all of the nutrients that the joint would provide if it were healthy. So we're just supplementing. We're not replacing what the body is doing on its own, but oftentimes because of injury, because of age, because of obesity, just because of genetic predisposition, they're not able to provide those joint building blocks. And so we provide them, and completely different from just blocking the pain sensors, we're actually providing what the body needs. And so oftentimes veterinarians will start on both Connectin and the NSAIDs and work to get the animal off the NSAIDs, because there are some liver and kidney side effects that you don't want to continue long-term if you don't need to with the NSAIDs. When we did our clinical studies with Connectin, we found that there were no side effects. So we looked at kidney health, we looked at liver health, we did full blood work, and we found there were no side effects. So that's why it oftentimes is that you want to continue with Connectin for the long term instead of using a non-steroidal option for long term. Do I start with the initial or maintenance dose of Connectin? How do I start? So on the label, it will give you, based on weight, how much to start with, which is an initial loading dose, and then you can go to the maintenance dose in about a month's time. When we did our clinical work, what we found was that to get optimum results, that you will start with the loading dose, which is twice the maintenance amount. So you'll start with that. And then what you'll see is you'll quickly see results. So the results are going to look like your animal can now run, can jump, can go up and down stairs. When they're getting up or lying down, they're not hesitating. They're doing it with a really fluid motion. So you'll be able to see the results. There'll be something that you'll notice. And then after about 4 to 6 weeks, what we found in our clinical studies was that those results will hold. And that's when you can go to the maintenance or half the amount. And you'll continue to see those good results, but you don't need to give more if those results are holding. Now, if you know that you're going to be going out on a long hike and you might want to move up to the loading amount, that's fine. It's fine to do that. I thought the joint issues were just in large breeds. Why do small breeds also need joint support? Well, it's mostly because of the actions that they have where they're jumping up and down so much, and then their knees are so just the way they're designed, the kneecap will actually pop out of place, and that's like the worst possible case scenario. You want to get that cartilage and that joint built up and healthy so that doesn't happen. So I had mentioned that I have a smaller dog. He's about 25 pounds. And on my desk at work, I have a felt bed that I keep right behind my computer by the window so that he can lay in the bed and look out the window. But every time somebody comes by the office or the FedEx guy comes, he is up and down off of my desk. And I just have to shudder because he's jumping down and he's making that impact. And it is something that I'm very conscious of. And I've put a stool there so he jumps on the stool and then on the floor, but he'd much rather take the large leaps. And that, from a small dog perspective, he has been on Connectin since I rescued him. He was probably 12 weeks old, I would guess. So he's now 8 years old. So definitely think about the small dogs because they need care as well. And the cats, don't forget about our cats. At what age can I begin giving my young dog, who's currently 4 months old, Connectin? It's fine to start Connectin, as I mentioned, as they're in that high growth. So in 3 to 6 months, they're going through really high growth. So it's a great time to get their joints lubricated and to get that started. Are there any side effects to this or any circumstances in which dogs should not take this supplement? So that's a good question because I mentioned to you that in our clinical study, we saw no side effects. We looked for everything. We did full blood work and we did it at the beginning, the middle, and the end of the study to make sure that we had safety throughout. And we saw no issues at all. Now, add on top of that 2 things. One is that we have 20 years of field studies with Connectin. So before we put it into the marketplace, we did full clinical studies. It's been in the marketplace for 20 years. So in that 20 years, we have never seen a serious adverse event. So that's really a good thing. So not only can I say that it is safe, but we can prove it. So the second thing is, how can we prove it? And that is that we adhere to what's called a National Adverse Event Reporting System, NAERS. And that system, we report any instance where, for example, and this is our most common adverse event. So let's say you have a Labrador Retriever and he knocks the container of Connectin over and he eats the entire container. So they're soft chews, say there are 100 soft chews in there, and he eats the entire thing. That would be an adverse event, and we would report that, but it's our most common adverse event. So I can tell you what's going to happen is that he will maybe get a little bit of stomach discomfort, maybe have some short-lived diarrhea because the herbs make up some fiber in the product. But most cases, nothing will happen and he'll be fine. So the product, but we enter that into that adverse event system. The Food and Drug Administration has access to all of those results. So we have shown over the past 20 years, not only that in clinical studies it was safe, in field studies it is safe, but we have adverse event reporting that goes over that 20-year span that shows no serious adverse events in any of our products, Connectin included. Is there anything I can do to spot or test for joint pain in a young cat? Ooh, yes. So one of the things we watch for is with our cats, when they start to have joint pain or discomfort, one of the things that they do is they stop grooming themselves on the back end because it's uncomfortable for them to twist and to get to their back end. So you'll start to notice that the back end isn't groomed and might even be matted. You might also notice that they don't want to jump into the litter box. And so they might be going to the bathroom in other places or around the litter box because it's just not comfortable for them to jump into the litter box. Other things would be that with cats, they do like to jump into perch. So you might notice that if they jump up on counters normally, they're not doing that. Or if they like to jump up in bed or on the couch with you, they're not doing that anymore. Also, if there's a reaction to touch, those would be some of the clues. The last one that we see is that it is they're with their nails. So with cats, they have a scratching post. Typically, sometimes it can be a sofa or carpet or something, but they'll stop using that because it's painful. So the digits in their paws are where the arthritis might originate. That's what you would see as longer nails, and they're not wearing them down. So those are things to watch for with our cats. Let's see, along with the question above, he doesn't jump so well, so I'm not sure if it's from joint or from weak muscles. How can I check this at home? So one of the things that we would suggest is that you would start on joint supplementation, which will allow the muscles to develop. You want to keep strong muscles around this joint capsule because if you can keep the muscles strong, then the joint will stay healthier. But it's a little bit of a chicken and an egg because if the muscles aren't strong, then it's going to be harder for them to get the activity and the exercise because it's just not as comfortable. So start them on joint supplementation. Work on getting more movement, even if it is just flicking the joint supplement down the hallway so they have to run and get that every day so that there's a little bit more of a play time that goes along with supplementation time. And that will help to do both, to get the joints healthy and also to get the muscles healthy. Next question. Are there any environmental changes we can make to help with joint support? On the environmental side, it's always good to keep them stimulated and to keep them. So one of the things that I like is that with my cats, I have 2 cats. They're 13 years old. They're indoor cats. We live on an open space field, and so there are a lot of predators out there, and so we don't let them go out at all. So they have 3 different cat condos, and they all have scratching posts integrated into them. So my cats have the option that they can scratch, they can climb. There's a bed at the top of the cat condos. I know that Pet Food Express has a lot of good recommendations for how you can create an environment in your home that allows for more mobility, allows for healthier scratching, healthier climbing, allows them to be more like cats. And that's what we're going for, is keeping their joints healthy and then creating that environment so that they have the ability to move around. And I'm still just so thrilled that my 2 13-year-olds are siblings, and I will go looking for them and I will find them perched up in the very, very top bed of the cat condo, and or inside the little tent. It's because they like to hide, and you doing all of the really good cat behaviors, and that they're still able to do that and to move smoothly. I would also recommend that you integrate play. And so I have chickens, and I will take the feathers that the chickens molt, and I will just bring those in and either tie them or just flick them. And the cats love to play with the feathers, and they are by a large window, and the chickens like to march back and forth past the window. And I also have some bird feeders, and they really enjoy getting a little bit more of their normal environment, but in a very safe way. Let's see. Okay, so next question. If I have an elderly cat who's been on Connectin for a few years and she is experiencing more joint issues, can I increase the amount, and will it do anything? So absolutely. I had mentioned before that if you have a situation where you're getting ready to, go on a hike would be more for a dog, but let's say the weather is changing, and you know that with the change in weather that you will often, your dog or cat will experience more joint issues. Or they're playing, they're tumbling, they're doing things that will maybe not make them feel so great the next day. You can always increase the amount. Through all of our years of testing and through our adverse event reporting, we know that increasing the amount will not create any adverse effects. It is fine to do. And if you need to increase, you can. We have formulated this, and the amounts that are listed on the label are for a normal situation. And if your situation isn't normal, feel free to adjust that. And sometimes that can look like less, and sometimes it will be more. If you ever want to contact us for any specifics, if you have a weight and a situation, please, please, please feel free to do that. Our toll-free number is on every container of product. I am the product developer for all of our products, and the favorite thing that I do every day is talk to consumers, to pet parents who are using or trying to determine whether to use a supplement and have some questions. I'd also flashed on the slide earlier my email address and contact information, but you can, if you go to our website, there's an email, support@inclover.com, and our website is inclover.com. And you can certainly submit a question, and we'll make sure to get it answered, and to get it answered quickly. All right. I think that was the last question. Linda, is that correct? Those are some great questions. All right. So with that, I am going to wrap up, and thank you so much for coming out on a Sunday and learning more about how to start supplementation and how to have healthier animals overall. Thank you so much. I appreciate it.